and then dealing with symptoms, often including pain and fatigue, which are considered two of the most difficult symptoms to deal with in living with autoimmune disease, not just because of the physiologic impact, but because people don't see them, and therefore people don't understand them. The challenge, the emotional impact, autoimmune disease can be chronic, debilitating, life-altering, misunderstood, and as you're hearing over and over, underfunded. Let's talk first about the impact of autoimmune disease on the patient, the person who is living with the disease. Physical impact is obvious, dealing with the symptoms, pain, any of the other symptoms. But people are less aware of the psychological impact. People are just not feeling like they want to feel. They can't do the things they want to do. People don't understand some of the issues that we mentioned before. This wears on people. It can affect their self-esteem. There have been studies that show, by and large, that people who are living with chronic illnesses have a lower self-esteem than the general population. This is awful because I believe that self-esteem is basically the foundation of who we are and how we deal with life. So people are already dealing with a disadvantage. Socially, people have a hard time doing as much as they want. They may experience difficulty with friends, with activities. You heard Dr. McDonald talk about how her daughter experienced bullying and how high a percentage exists of people who are bullied. But there are other problems there. It doesn't just have to be bullying. It can also be isolation, where people don't want to associate. In fact, some of the diseases that are listed as an autoimmune disease have names that are frightening. Years ago, when people had lupus, people misinterpreted that as leprosy. So they didn't want to go anywhere near somebody with lupus. They thought they would catch it. Behaviorally, there have been so many studies showing that autoimmune disease can affect persons' behaviors, not just the kind of shyness you heard mentioned before, but it can affect the brain, it can affect cognitions, it can affect the things that people do. And in many cases, unless there is a diagnosis with clear research illustrating this, people don't understand why behavior has changed. There are many times, for example, in my practice as a psychologist, people will come into my office, they have an autoimmune disease, and they will tell me about a prior experience trying to work with a psychologist because they were having trouble coping. And they told me, well, the psychologist said to me that my problems have nothing to do with my autoimmune disease. It must have to do with me being beaten when I was 3 years old. These are people who were basically fine and well-functioning until they were diagnosed. There is a connection. And then obviously there is the financial impact, and you heard Dr. McDonald mention that as well. Okay, on the family, we're dealing now with more of a collective impact. Loss of direction. A diagnosis of an autoimmune disease in the family can completely change the direction of the family, especially if it's in a breadwinner, but just as commonly if it's in a child, because parental responsibilities have to change. When you're dealing with that loss of direction, when you're dealing with lifelong plans that have to be changed, imagine that impact. So you will have people who are now having to explore different life paths. That can be scary, especially if combined with the fact that people don't know what's going to happen to them physically. Every member of the family is affected by autoimmune disease, not just the quote-unquote patient. And all people out there have to be aware of that, because unfortunately, if a patient goes to the doctor, family members are often not included. Sometimes they have to be the bullies. They have to bully their way into a consultation so they can be heard and they can listen to what the doctor has to say. Then the financial pressure can affect everybody in the family as well. You have people who are healthy, who feel that they're not getting their fair share because so much more may have to be allocated to the person with autoimmune disease. There is an impact on the community as well. People who may be very viable, productive individuals giving to the community may not be able to do quite as much. So there is a deficiency of sorts where the community used to be able to depend on certain contributions, and I'm not talking about financial contributions now, I'm talking about services, productivity, any of the things that people like to give and the community benefits from receiving. There are financial responsibilities on the community as well, having to be able to provide services. And of course, there is a disconnect where the community just doesn't know how they're supposed to deal with people with autoimmune disease. They don't always pay attention to them the same way. They sometimes just disregard them. Somebody walks into a restaurant, the waitress comes over, asks for the order, and asks them more loudly because they have a disease. Why? Next. Characteristics of the typical autoimmune patient. In working with autoimmune patients for more than 30 years, I have found them to be an incredible group of people. Very, very hungry to learn, very supportive of their own situations, and self-advocating. And this is one of the most important recommendations that I always have. You heard mentioned before that there is a need for more education. Education both for medical professionals and for the consumers. Well, the education for the consumers has to be to help them to self-advocate, because in many cases, if you're living with an autoimmune disease, if you don't look out for yourself, you may have a much harder time finding anybody who will. They are hungry. They are searching for knowledge, inhibited but motivated. They want to do more. They want to help themselves, but they may be inhibited by physical or psychological manifestations. Autoimmune patients, patients who are living with chronic illness, often feel like they're on the outside looking in. That relates to the feeling of disconnect I mentioned before. Imagine how that feels. People who are here who are living with autoimmune diseases are nodding their heads. People who aren't need to understand how that outside looking in feeling can be so debilitating. And then there's always hope. Hope has to be the carrot dangled in front of people. If people lose that hope, then they start withdrawing from life. We don't want that to happen. Sometimes we need to think things through a little more. Next slide. Hoping enhances coping. As you can see, I focus on coping here. There are new treatments that have already started having an impact on a number of autoimmune diseases, and there are many more coming down the pike. Practically every pharmaceutical company has drugs in its pipeline that will deal with some of the autoimmune diseases because it's big business to them. Well, fine, let it be big business to them. It's big business if it helps the people that we're trying to service. That includes medications. It includes different things that doctors can do. We also want to enhance hoping and coping through increased understanding and more support. Sometimes it's just not your day. For people who are living with autoimmune disease, it may never be their day. Our job is to be able to provide new ways to help them make it their day, to always have something to look forward to, always have a reason to live. And this goes for the person living with the autoimmune disease and the family members. We want to increase sensitivity. We want to increase support, and we want to increase services. Some of those things, but not all of those things, require money. Money always helps. Funding always helps. But awareness is just as important, and funding helps with awareness as well. So let me leave you with the motto of my organization, the Center for Coping from Long Island, and that is, no matter what problem you may face, you can always improve the quality of your life. Each and every person here today has demonstrated that they're willing to do just a little bit to improve that and move in a better direction. Thank you.
I'm now going to introduce Virginia Ladd. She's Chief Executive of AARDA, and she's going to talk about making autoimmune disease families a national priority.
Thank you. you very much, Bob. I'd like to thank everybody for attending this briefing. And what I'm going to do is try to capture some of the takeaway points that we would like you to leave this room with an understanding that autoimmune diseases really are a significant health crisis. We do not believe that these diseases are being taken as seriously as what they need to be because of their impact not only on the patient, but on society and the healthcare cost. When you see a health policy report, you often do not see autoimmune disease category even listed. You will see cancer, you will see heart, you will see diabetes, you might see obesity, but that's it. You do not see arthritis usually, and you do not see autoimmune diseases. Yet, we heard that up to 50 million people have an autoimmune disease. So that has a very significant, we heard also the number that become disabled. These primarily affect young women as a major category. So when a young woman with MS becomes disabled within 3 years, she lives a lifetime of disability on heavy-duty medications, heavy-duty healthcare costs. So why it's not part of a report on healthcare policy and the cost, we don't know. You cannot actually find the cost of autoimmune diseases. We should have that. How do you set policy when you don't have that? So that's one of the take-home is the cost of these diseases and how that really can impact on any healthcare system just by virtue of the numbers and the cost. The next take-home message, and it was alluded to, is these diseases are connected by a biological pathway. We at AARDA like to say a common disease pathway and a common genetic background. So how do these two interrelate? That background, that propensity that you might be born with, as we saw a whole family here. I also have a family that could circle 2 of those tables with autoimmune diseases. It actually was one of the reasons that I founded the organization, is I saw that in my family, but I didn't see any reports or studies that showed that these were connected. And that's where the MAGIC study actually came from. Was something that we were pushing from AARDA. And so how does that happen? We see that it does impact on families. So that's a result of these biomarkers, which is really the biological pathway, is back to biomarkers. These are things that you may have that can show up in your blood and tissue and indicate that you might be at risk for an autoimmune disease. So what triggers that propensity, that's probably genetic, this is possibly environmental risk. And they're not always just toxins. We saw many things that can play into an environmental risk, including infections. There's not a lot of study, though, on infections as a trigger for autoimmune diseases. So that's an area of how these biomarkers work with environmental triggers, and that's called epigenetics. So we're looking at predicting, as we talked about, and if we could find out what triggers that, we could prevent. So at AARDA, we actually have, in our strategic planning, we want to go toward what we call the 4 Ps. We haven't given up on a cure, but we understand that cures are few and far between. And now that we know we are all really quite different, they become very rare. Within any disease, even polio was prevented. So what we would like to see is much more research into these biomarkers or pathways of disease over all the autoimmune areas. And then what environmental triggers, what epigenetics plays into that so that we could then prevent them. And if we cannot prevent them, at least provide individual treatment so that a person is not damaged by a treatment that is not only very costly, but doesn't help them. But if we can bring those 3 Ps together, we won't need a cure. Because in order to cure something, you actually have to have it. We want to prevent it. We want to find out what causes it. We want to prevent it so that those health care costs will not be part of our health care system. They will be prevented along with the diseases. And we have a 4th P. We, of course, would like to see provide for the regeneration of damaged tissue so that can be replaced, and that might be through future research. So that's the direction that we at AARDA think in, and that's the direction that we promote. And the next take-home message is these diseases are really underfunded. Because we do not know the cost, we can only quote Dr. Fauci of 10 years ago. Now, 10 years in healthcare cost, just think back what your healthcare bills were a decade ago and think what they are now. 10 years ago, he said that these diseases collectively cost $100 billion annually. That did not include loss of work. That was medical treatment. In Canada, where they actually do track, at one of our briefings, the head of their immunology said that one out of every $7 is spent on autoimmune diseases in Canada. That's a tremendous amount of healthcare cost that, again, I will go back to what I said before, is not being considered because most of the time it's a single disease that's considered and the cost of the single disease, when we really need to look at the broader picture because they share a common disease pathway and genetics, just like cancer does. So that is the take-home message, that these are underfunded. They're a disease category that is one of the best-kept secrets. I have to say, even up here on the Hill, it's a secret. Now, you will know about many of the single diseases, and those are important. And research into single diseases helps us understand the broader category. But as Noel Rose, happens to be a researcher who discovered the first autoantibody, has said, each one of these diseases, if you think of them as one of the cars on a train, if we don't know the engine, we can't do anything about the cars. We have to know the engine driving, and that is the biological pathway of autoimmunity. So thank you very much for coming.